Welcome to Valley Regional Hospital. I'm your host, Elizabeth D'Orazio, and I'm joined by Dr. Gailyn Thomas, OBGYN here, and she has joined the staff to help bring the ever-increasing quality of care right here locally to customers in the Valley Regional area. We're going to hear what brought her to this place and why you should perhaps think of seeing her if you have the need. Thank you for joining us, Dr. Thomas.
You're welcome.
Now, women's health is a really comprehensive issue. What made you decide to bring that locally here to Valley Regional?
Valley Regional has begun a very productive affiliation with Dartmouth-Hitchcock Medical Center, which will allow services from various specialties to come to Valley Regional.
And women's health covers so many issues. You know, it's everything from, gynecology to obstetrics to, postpartum care to prepartum care. And it really is wonderful that someone can have those services locally and yet have the benefit of having a baby at Dartmouth. How do you feel about being able to offer that level here?
I think it's a terrific addition to the community and a lovely service for women. It's going to be much more convenient not to have to travel for visits and for routine care from the local area, but to be able to use the hospital for what it's best at, which is.
And one thing people forget is OB and GYN isn't just babies. So you don't have to worry about it. If you're not having a baby, there's still ways you can help someone, right?
Sure. A lot of women's health care is gynecologic care, so routine exams, problem visits, surgical care. All of the gynecologic surgeries that are generally done at a community hospital can be done here and will be. Specialist care, such as gynecologic oncology or reproductive endocrinology and fertility services, those will still be provided at Dartmouth.
And the nice thing is, because you have that link, whoever is working with you will know that you've kind of helped them through the process and you've referred them to people that you know and that are going to help them get that, nice high level of care, but in a local setting here.
Sure, and I will have access to those consultants as well for any questions that I might have that might save the patient a visit to Dartmouth.
I have recently had a baby, and I will tell you the most wonderful thing. Thank you. And one of the most wonderful things is knowing that you can get your postpartum care at a local hospital.
Sure, along with your prenatal care. So much of the care can be provided here, either by the Dartmouth-Hitchcock midwives who come down here, or by myself.
And being in a close proximity to your women's care provider is really a great benefit for women, particularly if they work in the community. You don't have time to necessarily drive far away for your routine care. Do I really have time on my lunch break or before work, to have that appointment? But really, Valley Regional has done a fabulous job by bringing the urgent care here and also bringing doctors like yourself here where you don't have to worry about that.
That's a nice service. It's particularly true in prenatal care where the visits do occur very frequently, or for problems that come up quickly and really don't benefit from waiting a long time to be seen.
Could you tell us perhaps why you love your job as an OB?
Well, OBGYN is great in that it combines some element of primary care where you get to see people frequently over time, both for well women visits and for problem visits. It combines surgical care, so you can perform someone's surgery, see them back for their post-operative care, and then continue to see them over the years afterwards to monitor the success of their procedure and how they're doing.
And you're very personal. I think one thing that strikes me is a lot of your patients feel comfortable enough to call you by your first name. That's true, and that's particularly been true in New England. Originally from the Philadelphia area where care was a lot more formal, but one of the really nice things about Vermont, New Hampshire, this area is that people do tend to be a little more informal and a little more comfortable, I think, asking questions of their providers. But I think it also says something about you. So if you're interested in perhaps availing yourself of local care, women's health specialty, and OBGYN services right here at Valley Regional, remember you can see Dr. Thomas or Gailyn, however you feel comfortable, and really you don't have to sacrifice your time because you know you're in the best of hands.